one and all. I am Dr. Nambirajan, cardiologist from Coimbatore, Tamil Nadu. Today, I'm going to talk about the hypertension and its effects on cardiovascular mortality. As we all know that India being the hypertension capital, apart from diabetes capital, hypertension is seen among various populations. It affects more than 45% of the people around 50 years. Right from the age of 15 to 50 years, the men are affected more than 38% and women are affected 32% by hypertension. Hypertension per se is called as a silent killer. It is one of the main cause of death by causing your heart attack, then your stroke and kidney disease. It is the main cause. 1 in 4 adults between 15 to 54 years in Indian population suffers from hypertension. And the saddest part is more than 50% of the population among this age group doesn't know that they have a hypertension. That is why it is called as a silent killer, because it does not have severe symptoms until it becomes a later stage. Hypertension especially affects the high BP affects the heart and the kidneys and the blood vessels and the eyes, and it causes permanent damage to the kidneys and the eyes and the heart. It is the one of the most important cause for the heart attack and the heart diseases in our country. So this hypertension can be recorded either in the home or in your office. So whenever a patient enters the doctor's office, and the BP will be highly recorded. This is called white coat hypertension. So the latest guideline from the International Society of Hypertension 2020, it highly recommends ambulatory blood pressure monitoring, especially, and also the home blood pressure monitoring to be done at the home or in the office. So out of office BP in the home and the out of doctor clinic BP is also highly recommended. So you need to take important medications for lowering the blood pressure to the desired level as advised by the doctor. So these drugs could be a combination of 1 or 2 drugs. Normally 4 to 5 classes of drugs are being used to control the high blood pressure. The combination therapy would be of better, because most of the patients in Indian population, the studies have found out non-adherence to the therapy is an important factor. So in order to avoid that, we need to have a combination of 2 to 3 class of drugs so that the desired BP comes to a better control and to avoid the end organ damage caused by the hypertension. So the lowering blood pressure, apart from the drugs, the important aspects, non-pharmacological or non-medicine therapy is most important. For example, to reduce the salt intake to less than 4 grams per day. So you should avoid salt containing foods like pickles, puppets, and tin contained stored foods. So all these added salt should be avoided in food. And you should adhere to DASH therapy, dietary advice to stop hypertension. You should take enough fruits. 5 heapful of fruits should be, handful of fruit should be taken per day. So, and regular walking feasible, 30 minutes per day, 5 days in a week. All these things will prevent your hypertension to make it a better control and to avoid the complications like heart attack and other stroke, and to avoid chronic kidney disease. So hypertension is a silent thing which is being seen in our Indian population right from the age of 20 years to 50 years, and it is around 40%, more than 40% in women and men. So it is a very common entity which we neglect to see. So from today onwards, you make an effort. Either you, that is the key carry home message is know your numbers. Know your numbers is not your mobile numbers. Know your BP values, the systolic BP and the diastolic BP. The BP which we mentioned in the top of the 140/80, 140 is the systolic BP recorded during the contraction of the heart. Diastolic BP is due to the relaxation time of the heart. So you should know your numbers every 3 months you should know your numbers, and if it is elevated more than 140 and diastolic BP is more than 100, you need to take either the stage 1 hypertension, you need to undergo non-pharmacological therapy, and if it is not controlled with non-pharmacological therapy for 3 months, after 3 months you should seek the advice of the doctor and take the drugs appropriately prescribed by him. Don't go for self-treatment. Don't assume that hypertension will not do any harm. Once again, I am saying this is a silent killer which has got the highest mortality. This is the one of the important cause for heart attack, stroke, and chronic kidney disease. So I advise each and every individual to check the BP every month and to go for a ambulatory blood pressure monitoring if possible, and home blood pressure monitoring, and it should be evaluated every month for patients above 40 years. And if the patient has got other comorbid disease like diabetes and your chronic kidney disease and COPD, obesity, high body weight, then you need to take the measurements often and try to control the blood pressure to the desired level to avoid the unwanted effects of the blood pressure. So it is a very common thing seen in our day-to-day practice. So I urge everyone to know their numbers and try to adhere to the DASH therapy and regular walking and avoidance of salt. These are all the key factors which will allow you to control the blood pressure and protect your heart, protect your kidneys, and protect your brain from the stroke attack. Wish you all the best. Thank you very much for patient listening. Thank you.